All right. Good morning, everyone. This is Kristen Appold. I am the senior for the Needs Analysis Unit within the Division of Drinking Water. I want to thank you all so much for joining us this morning. We are very excited to share with you the results from the needs assessment. And I think we're just going to get started. We still have a number of people joining us, but we have a lot of content to get through today. Can I go to the next slide? So on the slide here, you'll see that this is the Water Board's mission collectively, and we achieve our mission through an array of programs established within the divisions and regions. So let's get into this. This is supposed to be an interactive webinar. We are going to be sharing with you results from our needs assessment, but we want to hear from you and try to answer as many questions as we can. We recognize that this is going to be a long 3-hour webinar. We do have a break at the halfway point, but we really want to encourage you to submit questions to us throughout the presentation. We do have folks who are joining us via the Cal EPA webcast, and if you have any questions, you can submit them to our safer@waterboards.ca.gov email address. We do have a staff person who is monitoring that inbox. So if you submit questions to that email address, we will add them to our Q&A queue. For those of you who are participating via Zoom, you should be able to see a Q&A feature at the bottom of your Zoom screen, and you can ask questions, type them in there. And if you see a question that someone else has typed in and you have the same question, you can actually upvote that question, and that will raise it higher up in the queue for us to get to. But we also want to hear your voice. So if you would like to say your question out loud, you can also raise your hand during our Q&A sessions, and I will call on you when it is your turn, and you can unmute yourself. If you are calling in via Zoom, you can press *9 to raise your hand, and then you will be asked to unmute yourself, which would be *6. And I will repeat these instructions later on. But we do have Q&A sessions throughout the webinar, not just at the end, so that we can get to some of your questions right away. All right. I am just thrilled to talk about our needs assessment. We have a lot of content to get through today, and we have a number of panelists with us. I will be moderating the entire session, but I'll also be a panelist part of the time, so just bear with me. Today, we're going to get an overview of the needs assessment. We're going to talk about our failing water systems list, also known as the Human Right to Water list. We're going to talk about our risk assessment methodology and results, our cost assessment methodology and results, the affordability assessment methodology and results, and then conclusions and next steps. But before we begin, I wanted to get a sense from all of you. Let me launch the first poll. Have you participated in any of our webinar workshops that we've been hosting on the risk assessment or the cost assessment over the last year or so? This will help give us a sense of how many of you may already be familiar with some of the methodologies that we're going to be talking about today. For those of you who are participating via the EPA Cal webcast, there is a bit.ly link here, which if you type it into your browser, you can actually respond to our poll questions and submit questions via a Microsoft web form. All right, just a few more seconds. It looks like we have most people participating in the poll. I'm going to end it, share the results. And it looks like a fairly even split, but the majority of you have not participated in any of our workshops, which, makes me a little sad, but that's okay. We did incorporate a lot of materials into the presentations that give you more background on the methodologies used in the needs assessment. So that should help you bring you up to speed on where we're at. All right, one more poll question before we get started. Question number 2, have you read the report, 2021 Drinking Water Needs Assessment? We just launched it, and let me go back here. Let me try to get to the next poll. Stop share results. Number 2. There we go. We launched an updated needs assessment webpage that has the final report and all of the supplemental attachments that go with it on Friday. So maybe some light reading for a few of you over the weekend. All right, give you a few more seconds to respond. All right, I'm going to end the poll and share the results. It looks like the majority of you have not read the report yet, but you plan to. A few folks have actually skimmed it. We have 2 people who have read the whole thing, which bravo, it is over 300 pages, so that is fantastic. I wouldn't be surprised if it's someone, one of our contractors or someone on our team at the water board. And then we have a few folks who don't intend to read it, which is totally fine, and hopefully you'll get what you're looking for out of today's presentation. All right, I appreciate you filling in these poll questions. It's always helped to kind of get a sense of who's with us today. So let's get into it. I think it's always important when we talk about the needs assessment to step back and to really go back to 2012 when we passed the human right to water, which is every human being has the right to safe, clean, affordable, and accessible water, adequate for human consumption, cooking, and sanitary purposes. The Water Board tries to identify water systems that are failing to meet the goals of the human right to water. We often call these systems our failing water systems. And if you look at our website, or if you're familiar with our human right to water list, we look at all public water systems in the state. We have our criteria, which I will go over in just a little bit. But it's important to kind of put this in context because the Water Board, our goal is to help bring these systems back into compliance, but we also want to help systems from not going out of compliance, to not get on the list. We want to prevent them from getting on this list. If you look at the systems that have been coming onto the human right to water list or that have been failing, you'll see that 90% of the violations occur with water systems that are serving less than 500 connections. And you'll see why this is important later on. And so in 2019, with the passage of Senate Bill 200, we were able to get enough tools and resources to really make a big dent in addressing the goals of the human right to water. It's really exciting. We were able to establish the new SAFER program, which is the Safe and Affordable Funding for Equity and Resilience program. This program at the State Water Board, which spans many divisions, has, again, many tools and resources that help us address those human right to water systems, but also it gives us the tools and resources to help those systems that may potentially be failing, to keep them off the list. Foremost among those tools is the Safe and Affordable Drinking Water Fund, which is a new funding source for the State Water Board that has a unique set of funding eligibilities. We have new programs under the SAFER umbrella for data collection and analysis. We have a lot more tools and resources to help us with consolidation, regional solutions, water system partnerships. You might have heard about the Water Board's Administrator Program and our authorities there. And then, continued focus on technical assistance and capacity building. So doing a lot underneath the SAFER umbrella. And we work with a lot of different folks to implement the SAFER program. Like I said, it's really a program that spans multiple divisions within the State Water Board. We have the Division of Financial Assistance, which helps administer that funding program that I mentioned, but also many other funding programs that can help support the goals of the SAFER program. We have the Division of Drinking Water, which is where my unit is located. We conduct the needs assessment, which we'll be talking about today, but we also have staff located throughout the state who are really helping to engage with water systems to help identify potential long-term solutions, to connect them to interim assistance. A lot of fantastic work happening there. We have our partners within the Division of Water Quality, and you'll hear from Emily later today, that work really on identifying state smalls and domestic wells that may have source water quality issues. And then we have our partners at the Office of Public Participation. You may have participated in some of their workshops, but they really help us engage with the public. They help with meeting facilitation, connecting with tribal communities, and working on the ground where we're trying to do our work. But the SAFER program is more than just the State Water Board. We collaborate with a lot of partners beyond our agency. We have our SAFER advisory group, the folks that you're going to hear from today across many different organizations that helped stand up our baseline methodologies for our needs assessment, and many other agencies, our partners over at OEHA and DWR. Again, we're collaborating many different ways to advance the SAFER program. Like I mentioned earlier, one of the big new tools that we have in our tool belt is this Safe and Affordable Drinking Water Fund. It's this new funding program that was established under SB 200 that provides up to $130 million a year through 2030. What's unique about this is that if you look at the language, it says that the annual fund expenditure plan, which helps prioritize projects and funding for this new funding program, that prioritization needs to be based on something called the needs assessment. What is the needs assessment? The needs assessment has three core components. It has a risk assessment, a cost assessment, and affordability assessment. And again, we're going to be diving into each one of these in detail in today's webinar. It's important that we're doing this because our needs assessment results help prioritize where the SAFER program should be focusing its efforts. Always at the top of our radar is the failing water system. So systems that are currently out of compliance. Public health is our #1 priority, and so failing water systems and getting them the help that they need will always be our top priority. But we needed a way to prioritize other systems that aren't failing. And so you'll see today that we've developed a methodology for identifying at-risk water systems and domestic wells, and then potentially at-risk systems, and then systems that are not at risk. And this prioritization really helps guide us for SAFER efforts within the Water Board. And this is just a simple little infographic to try to explain how everything is interconnected. Our needs assessment helps prioritize funding in the annual fund expenditure plan, which helps set our priorities, and then helps us with our folks who are spread out throughout the state with the systems that they're engaging. The needs assessment has undergone quite a journey over the last year. This is our first year in developing a comprehensive methodology for conducting the needs assessment. We have been working extensively with our stakeholders, with the public in developing these methodologies. We did not want to develop them in a vacuum. We wanted to be very transparent about our approach. And so we hosted many, many workshops and webinars throughout the last year or so to collect input and recommendations. I really encourage you, if you're interested in learning more about all the different steps in between, check out our needs assessment website. We do have all of the white papers, webinar recordings, and PowerPoint presentations of our methodology development. Before we dig into the results of the needs assessment, I just wanted to highlight for you something that might stick out as we go through the different methodologies and the results, and especially if you read the report, the executive summary, or the full paper. You'll see that there are different numbers sometimes for our at-risk systems or human right to water systems, the inventory of systems that we looked at for the different assessments. And this was because in our first year, we were starting different components of the needs assessment at different times. And so they were using different data sets, which I know can be confusing as you read through it, but we wanted to call that out as something that was a challenge for us this year. And we're definitely going to be working next year to make sure that we start everything at the same time and we use the exact same number of systems and data to get us going. But just wanted to make sure that you guys were aware that you might see different numbers of at-risk systems, for example, or human right to water systems listed in here And the reason is because of the different dates that we started these assessments over this last year. But now I'm going to transition into our failing water systems list. I'd like to start here because a lot of what we're doing is about trying to help these water systems get off the human right to water list. We want to bring them back into compliance, but we want to prevent new water systems from coming on the list. So it's important to understand, what is the human right to water list? What is a failing water system? And we recently expanded our criteria, our definition, if you will, of what constitutes a failing water system. So before April, we had water systems that had a primary or secondary MCL violation with an open enforcement action were on the human right to water list. Based on feedback from the public and management and our board, we recently expanded the human right to water criteria to include a few more things. We added E. coli violations with an open enforcement action. We added treatment technique violations with an open enforcement action, or if a water system has had 3 or more treatment technique violations over the last 3 years. So if you have a water system that has repeated treatment technique violations, that could be an indication of TMF capacity failure. And so that's going to get you on our failing list. Similarly, we have monitoring and reporting violations. If a water system has 3 or more monitoring reporting violations within the last 3 years, and one of them is still open, has an open enforcement action, and has been open for 15 months or greater, then you're also on the failing list. We do keep a map and lists of our systems that are on the human right to water list on the Water Board's website. We have a few different places where this is at, and I've shared the hyperlinks here. And this presentation will be made available to everyone who's registered today, and we're going to be posting it on our website as soon as it is made accessible. We did a data refresh yesterday. We currently have 331 water systems on the human right to water list, and 29 of these systems are meeting the new and expanded criteria. So you can learn more on our website. We also are going to be posting later today a paper that really details the criteria. So every single violation type that we look at is in that paper if you're interested in learning more about our criteria. We do provide assistance to our human right to water list systems. Currently, 90% of these systems are working towards long-term solutions. If you're interested, if you're a water system that finds yourself on the human right to water list, we do offer financial assistance. There is an application form that you can fill out. We also have technical assistance available and wanted to provide those links here. But like I said, our challenge is keeping water systems off the list. And based on our analysis of the human right to water list over the last few years, approximately 47 unique water systems come onto the list each year. And so we want to be proactive. We wanted to create an early warning approach for identifying systems that are at risk of failing. I'm going to turn things over to Greg Pierce at UCLA, who's going to talk more about our risk assessment for public water systems. Greg?
Thanks, Kristen, and hi, everyone. Greg Pierce from UCLA. Before I jump into the results of the risk assessment, I do want to briefly acknowledge the work of the whole contracted team working with UCLA and in turn with the Water Board. You'll hear from a few of our collaborators in the rest of this webinar, and I believe we had 29 authors across the 4 groups plus the Water Board, so I just want to acknowledge this was really a team effort, both at UCLA as well as with our partners at Corona Environmental Consulting, the Office of Water Programs at Sacramento State, the Pacific Institute, and the University of North Carolina Environmental Finance Center. Turning back to the risk assessment, as Kristen said, the goal was really to develop an early warning approach or method to identify water systems that are at risk of failing before they fail, and then of course support them to prevent failure. And the first version of the risk assessment for public water systems included public water systems with 3,300 connections or fewer. As you can see on the slide here, most of those, the vast majority of those were community water systems. In addition, K through 12 schools and other types of public water systems were included, although K through 12 schools and other public water systems that didn't really have ratepayer bases were excluded from the affordability assessment, as we'll touch on later. Next slide. The risk assessment methodology really included 3 core components, and we've gone over these in quite a bit of detail in previous white papers and webinars. But essentially, it comprised 3 steps. The first is identifying risk indicators, which are quantifiable measurements of key data used to assess a water system's risk of failing. The next step, once the risk indicators were identified, was to assign or identify thresholds, which would be defined as values associated with a risk indicator that designate or indicate when a water system is again at risk of failure. And then the last step was for both each indicator as well as each indicator category to identify weights that would suggest or imply relative criticality of the indicator or category compared to the other indicators and categories in the risk assessment. Next slide. And our final list of risk indicators for the 2021 needs assessment in the report comprised 19 risk indicators. These were narrowed down from an initial list of 129 risk indicators through a stakeholder-driven and intensive evaluation process, which you can see the full details of again in previous white papers and somewhat in the final report. The risk indicators are organized across 4 categories: water quality, accessibility, affordability, and TMF capacity. I don't have the time to run through each of the indicators here, but as you can see, water quality has the highest number of indicators, 6 indicators. And I just want to highlight 2. The first is increasing presence of water quality trends toward MCL, which was the only indicator added back into the methodology since the last white paper and webinar. This indicator is built on water board data and essentially shows where water systems have a 9-year trend exceeding 80% of the MCL for a particular constituent or contaminant. And then maximum duration of high potential exposure is again based on water board water quality data, but it's really processed by and sort of calculated by colleagues at AWIHA, and as its name suggests, really gets at the recurring nature of exposure for particular contaminants of concern. Next, in the accessibility category, again, there's 5 indicators, and I just want to call out, in particular, the use of the Department of Water Resources overall scoring via its drought and water shortage risk assessment, which was recently conducted and finalized. And then in the affordability and TMF capacity bins, for affordability, it has only 3 indicators, and there's an explicit intent by the water board to both increase and enhance the indicators for affordability in future risk assessments. And then TMF capacity, again, 5 indicators, and we're hoping, or the board is hoping through additional collection of financial capacity indicators to potentially add there as well. Next slide. So those are the risk indicators, and we've gone through, again, in previous webinars and white papers and tried to explain the methodology, but the key things to keep in mind, again, are that the 19 indicators are not simply averaged or simply treated in the same way. Instead, each of the individual risk indicators was assigned a different weight. And then within each category, and again, there are 4 categories, each of the categories was also assigned a different weight based on judgment around the criticality of the categories, with water quality receiving a weight of 3, accessibility and TMF capacity a weight of 2, and affordability a weight of 1. This methodology allowed us to assign each of the water systems in the risk assessment as not, through the combined risk assessment methodology, as either not at risk, potentially at risk, or at risk. Next slide. And to enable the evaluation and comparison across risk indicators, A standardized scoring approach between values of 0 and 1 was applied to each risk indicator threshold. And then weights between values of 1 and 3 were applied to each risk indicator, again, to indicate which risk indicators were comparatively more critical. What you're seeing at the bottom of the screen is an example of what this looks like. Again, you can see all the details for all the indicators in the final report. But for maximum duration of high potential exposure, this indicator actually had 3 potential thresholds, each of which, if were exceeded by a system, would receive different raw scores. The weight for the indicator remains the same regardless of the threshold, and then the total risk indicator score for a given system is a combination of multiplying the raw score by the weight. Next slide. Then we wanted to illustrate how the math works. And again, you could do this by hand and see in the indicator data, the risk assessment data that's now been released, both in raw and process form, what the scoring really looks like. But essentially, it looks like this, where each indicator has a raw score, which is multiplied by its weight, and then is averaged within a category, then aggregated at the category level, multiplied by category weight, and divided across the 4 categories evenly for each system to receive an aggregated risk assessment score and label. Next slide. We do want to also note that in some cases, there was missing data. So some systems may have failed to report necessary data, or systems may not have data to report. Particularly, this applies for the affordability assessment, as I mentioned before. But to account for that, the risk assessment removed any value for a missing risk indicator and essentially redistributed the average scores and weights to risk indicators within the same category, which did have valid values, as you can see in the illustration below. And the same approach was used where whole risk indicator categories were missing for particular systems as well. Again, I believe that only applies to the affordability category. Next slide. So that's a brief overview of the methodology. What does this look like in practice, or what were the results of the risk assessment as described in the report? Essentially, here you're seeing the distribution of weighted overall risk scores across the systems that were evaluated. But a key additional step that had to be determined here was where the threshold would be applied to designate systems as potentially at risk or at risk. Essentially, these thresholds were determined based on where the current and expanded human right to water systems started to cluster within the distribution. I do want to be clear and say that the human right to water systems were not formally designated as at risk or potentially at risk or not at risk, because they're already on the human right to water list. But they were included in the risk scoring to compare and to essentially, again, enable to determine where the cutoffs or thresholds should be for other systems to be designated as potentially at risk or at risk. And what was ultimately determined in this version of the needs assessment was that the potentially a designation of potentially at risk would be assigned if the aggregate score for a system was between 0.75 and 1, and at-risk systems all received a score greater than or equal to 1. Next slide. And in terms of the breakdown of the 2779 systems included in the risk assessment, in this version, 326 were on the human right to water list. And then excluding those systems, about 25% were designated as at risk, or 617 systems. 23% were designated as potentially at risk, 552 systems, and then 1,284 of the 2779 were determined as not at risk. Next slide. An evaluation was also done for tribal water systems. And for the human right to water equivalent of tribal water systems, these were actually determined and identified by the US EPA using the same criteria that the Water Board used to identify human right to water list systems or public water systems, and then the overall distribution of tribal water systems and similarity in characteristics to small public water systems was used to determine estimates of the potentially at risk and at-risk systems. Next slide. So in the report, we break down the overall results of the risk assessment in multiple different ways. But what this slide is showing you is the results of the risk assessment across each of the 58 counties in California. And what this is supposed to indicate, I think most of all, is actually that most of the public water systems in the state were not included in the risk assessment among the 7,800 public water systems. But this is showing you, the proportion of systems that were not included in the risk assessment compared to those that were included and then designated as not at risk and human right to waterless systems. Next slide. But this slide shows you a little bit more about the breakdown of the systems that were included in the risk assessment by county. And again, we show this in multiple different ways in the report. But here you can see that there are in nearly every county, there are some at-risk systems, and that there are concentrations of at-risk systems, particularly in several counties in the San Joaquin Valley, as well as the more populated counties in Southern California and the Central Coast. Next slide. Another way to look at things, of course, would be to look at the population served by at-risk water systems. And in the overall risk assessment for public water systems, I believe the population served by those systems was approximately 2.7 or 2.8 million. But within that population, about 2 million or 73% of folks served by systems evaluated were served by systems that were determined not to be at risk, whereas about equal proportions or numbers, I should say, were served by systems that were determined as at risk or potentially at risk, 350 to 370,000 for each. Next slide. And something we really want to stress, and you can see much more about sort of the relative contribution of particular indicators to risk scores in the report. But something we really want to stress is that systems were not designated as at risk based on a single or even 2 or 3 risk indicators. Rather, actually all at-risk systems exceeded a threshold of concern for at least 4 indicators. And the average at-risk system exceeded more than 6 risk indicator thresholds. So what this is telling you in terms of an early warning system is that multiple warnings or sort of alarm bells were going off for at-risk systems in order to land them with a designation of being at risk. Next slide. So that's a brief overview of the results and the methodology on the risk assessment. As Kristen noted, and thanks to great efforts by folks on her team and also Kelly Trumbull at the Luskin Center, the data, both in raw and processed form for the risk assessment for public water systems are already online on the SAFER website. You can download them now, along with some explanation about how to use the data. And this data, the spreadsheet is already being potentially refreshed and will be available based on water board efforts in the next few months. So look out for updates as they become available. Next slide. Last but not least, if you are a water system and see something that isn't right in the data for your system, you can submit a data change request at the link you see here. Again, this is SAFER website, and requests will be reviewed by state water board staff, and they'll be in touch with you if you submit. But I think that is the end of my presentation. Again, I want to thank everyone for participating, particularly in the risk assessment over the course of this work. And on behalf of the entire contracted team, we look forward to engaging and supporting this effort into the future. Thank you.
Thank you, Greg. Appreciate it. I'm going to invite Emily to join us now, who's going to talk about the risk assessment methodology that was developed and utilized to identify at-risk state small water systems and domestic wells. And I think as she's unmuting herself, I just want to say, and she'll get into this a little bit, we did have to employ different methodologies for identifying these different types of systems, given the limitations that exist in the data that's available. So that is why you see the risk assessment methodology split up between public water systems and then state smalls and domestic wells. Emily, turning it to you.
Thank you. Yeah, that's exactly right. So I'm going to cover the methodology for state small water systems and domestic wells, and also the results. Next slide, please. So just a brief overview of the methodology here. Again, as Kristen just said, this methodology is very different from that of public water systems due to the lack of available data. And so what we did, because there's no statewide database for water quality results from domestic wells or state stormwater systems, although there is a little bit of data available, we basically used a source water quality estimation to collect data from nearby wells that are the best representation of water quality accessed by state small systems and domestic wells. After we gathered this water quality point data, we averaged this data to square mile sections and then to census block groups to get an idea of what water quality is for shallow wells across the state. The last step was overlaying the approximate locations of state small water systems and domestic well data to get a sense of where these systems might be located in reference to water quality risk. Next slide, please. So I'll just briefly cover where this data comes from and some of the steps we took to process it. So for the water quality data side, again, this is all source water quality, so it's all raw water quality. We're not actually sampling individual state small water systems and domestic wells, but it's all publicly available data from a variety of sources. We did apply a depth filter to these water quality data wells in an attempt to get at shallow water quality that's likely accessed by domestic wells and state small water systems. We applied some declustering to this water quality data. So we averaged the results by year, by well, and by square mile section. And this is just to account for variations in sampling in time and space. We looked at two main metrics of water quality. We looked at both long-term average, so that's the average of all water quality results from the past 20 years, but we also looked at the maximum recent result from within the past 2 years. We looked at all constituents with the maximum contaminant level. We also included hexavalent chromium. For the location data, again, we used publicly available location data specifically for domestic well locations. We used data from the online system for well completion records, and this is from the Department of Water Resources. We did a little bit of filtering to this data set. We excluded domestic wells drilled prior to 1970, just to account for domestic wells that may no longer be serving users. State small water system locations were from the Rural Community Assistance Corporation. Next slide, please. So this is just a little bit of detail on our depth filter. Again, there's a lot more detail available in the report if you're interested in learning more about this. But basically, we used well construction details for domestic wells in each groundwater basin in California to calculate an average domestic well depth interval that represents the depth which domestic wells are accessing water. We use this as a numeric depth filter on the water quality data so that we could get the best guess at water quality data that is serving domestic wells. However, a lot of the water quality data that we have is not associated with a numeric well depth. And so we also created a depth filter by well type. And to do that, we compared the average domestic well depth with the average public well depth for each groundwater basin in California. And the results of that are shown on the right. So for basins that had public and domestic wells at approximately the same depths, we used public well water quality data as a proxy for domestic well water quality data. So those are the basins in pink. And conversely, for basins where public wells are accessing deeper depths than domestic wells, we did not use public water quality data as a proxy for domestic water quality data. And those are the basins in blue. Next slide, please. So this is showing the statewide results for our water quality estimates on the left and the domestic well density and state small water system locations on the right. I understand it's a little bit hard to see this data because it's statewide, but again, we'll point out that all of this data is available online in a web tool format, so you can zoom in and see it a bit easier. But basically for the water quality data on the left, so using the water quality estimations, using the method I just described, we classified square mile sections as being high, medium, or low risk based on the estimated water quality compared to the maximum contaminant level. High risk areas are areas where the estimated water quality is above the MCL. Medium risk areas are areas where the estimated water quality is between 80 to 100% of the MCL. And low risk areas are areas where the estimated water quality is below 80% of the MCL. There's also a significant area where we did not have enough water quality data to calculate an estimated water quality risk, as you can see. And on the right just shows the domestic well and state small water system location data. Next slide, please. So these two data sets, the water quality estimates and the domestic well and state small water system location data, are combined in this final sort of risk assessment map that basically shows areas in red and warmer colors where there's the highest water quality risk and also the highest number of users that are accessing water via domestic wells or state small water systems. And it's really this combination of these two risk factors that contribute to the highest risk areas in this map. So again, all of this data is available in a web tool, so I'm not going to walk through exactly the different high-risk areas of this map, but you're very welcome to go check it out and zoom in on the web tool. Next slide, please. So now I'm going to just briefly break down the results by contaminant. So this is for areas that our water quality estimates indicated areas above the MCL, so where estimates were above the MCL. This is the breakdown of which contaminants were responsible for those water quality exceedances. So nitrate and arsenic were responsible for almost half of the exceedances, followed by trichloropropane, gross alpha, uranium, and hexavalent chromium. A further fifth of other exceedances were responsible or were caused by other contaminants. I will just briefly note that an area can be above the MCL for multiple contaminants, which is something to keep in mind when interpreting this data. Next slide, please. So before I go into the numbers, I just want to remind folks that there's a lot of uncertainty associated with both aspects of this data. So both the water quality, again, this is just an estimate of water quality based on nearby proxy data, and likewise the locations of domestic wells especially, but also to a lesser extent state small water systems, is not exact, and we're just using the best currently available data. One thing to note is that in coming years, as we update this, we do expect to have a bit more data for state small water systems and domestic wells because of new reporting requirements in Senate Bill 200. So that's just something to keep in mind. But for the numbers of domestic wells and state small water systems in these different water quality risk areas, there's potentially up to 78,000 domestic wells and 600 state small water systems in areas of high water quality risk. So that's where estimated water quality is above the MCL. And I'm not going to read through all the rest of these numbers, but I will just highlight that there is a significant number of domestic wells and state small water systems in areas where we don't have a lot of water quality data, which is also something we're hoping to assess in the future. So this is the breakdown of state small water systems per county in these different water quality risk bins. So the y-axis here shows the count of state small water systems, and the different colors show the different water quality risk bins: high, medium, low, or no available data. And this shows the results by county for domestic wells. So again, the y-axis shows the count of domestic well completion records, and the different colors show you the breakdown of how many domestic wells are located in these different water quality risk bins: high, medium, low, and no data. So again, this data is all available in the report. So if you would like to look at this in more detail, that's available there. Next slide, please. So yes, this is the link to the online risk tool. So all of the data that I've just explained is available as a web tool, which allows you to zoom in on this map, click on different areas, see the exact breakdown of which contaminants are contributing to the risk factor, how many estimated domestic wells are located in the area, et cetera, et cetera. So you can also download the data here, both in tabular form and as a shapefile. And additionally, there's a link that to explain the methodology in detail if you have any more questions about some of the methodology results I've shared today. And with that, that concludes my presentation on the risk assessment for state small water systems and domestic wells.
Thank you so much, Emily. I really appreciate both your presentation and Greg's presentation. A lot of work went into developing these risk assessment methodologies. And again, super excited to share these results with you. We do have quite a number of questions in the queue for our Q&A box in Zoom. Again, if you are participating via the Cal EPA webcast, you can email us at safer@waterboards.ca.gov. We do have quite a bit of time that we can dedicate right now to answering some questions that's come in. So I'm going to go through these in no particular order. And then I notice that some folks have their hands raised, and we will get to you very soon. Emily, there was a question. Could you explain step 1 of the methodology for folks one more time? And I'll go back to that slide.
Sure. So that's just the collection of point water quality data from sources that basically we think represent domestic well and state small water system data. So usually that's shallow. So that is basically from publicly available sources. So we used, public water well data, domestic well water quality data from USGS, Division of Drinking Water, a bunch of different sources from the last 20 years. And we just gathered all that data, applied the depth filter, and then went to averaging it. Hopefully that answers the question.
I think so. And Emily, there were a lot of questions around, the data sources that you used and whether or not this data is publicly available.
So yes, all of the raw data that went into this is publicly available. I do have the scripts that I use to collect and process the data also available via the web tool. So if you're interested in replicating this at any step, that's available as well.
Heather Lucas was asking whether or not the data set includes the domestic top and domestic bottom added to the data set.
I might have to read that question for
Okay.
some context, sorry.
That's okay. And we can always respond via email after the webinar as well.
There is a table in the needs assessment report that details, for each groundwater basin in California, the exact values that we used for the depth filter. So the average domestic, the average shallowest domestic, and the average deepest domestic well, if that is what that question is asking.
Great. There were a few questions in here about what is the State Water Board doing to collect data for domestic wells and state smalls to help fill the gaps. And I just wanted to briefly discuss that as part of SB 200, the foundational legislation that helped develop the SAFER program and get it stood up, It did include new requirements that counties report to the State Water Board domestic well and state small water quality data. It does require that the counties provide the Water Board water quality data back to 2014. And then starting in January 1st of 2022, so in just about a year from now, the counties will need to start submitting water quality data for state smalls and domestic wells to the Water Board electronically. My unit, the Needs Analysis Unit, has been working with counties over the last few months to try to collect that historical water quality data in an electronic format that can be readily accessible to those who are interested in using it. That is all available. The data that we're collecting, the approach that we're taking is all available on our website, and I can share that link later. I just want to stress, though, that there's a lot of limitations in that data, and I'm sure Emily can attest to this. Counties have very different policies on water quality testing. In some cases, domestic wells that are newly constructed are required to do a water quality sample, but that's only true for some counties. And most counties, there is no requirement for regular monitoring of domestic wells. There are some that have voluntary monitoring programs that do collect some data, but again, it's going to be very limited. We're hopeful that this effort in working with counties will help us create a better inventory of domestic wells and state smalls. So like Emily said, and Emily, maybe you can speak to this a little bit, you know, we have a data set from RCAC, but it's unclear in some cases, are these active wells? Are they not active? Emily, there was a question, why was 1970, you know, a cutoff point? We are hoping that working with counties moving forward, we'll have a better sense of what domestic wells are out there, which ones are active, which ones are not. Emily, did you want to speak to the 1970 cutoff?
Sure. Yeah, everything you said was right on point. The 1970 was selected mostly as a way to account for the fact that since 1970, there's been potentially a lot of expansion in California cities and areas that previously were served by domestic wells that had records in OSCAR. Those domestic wells basically may no longer be serving domestic well users, may be covered by a public water system or something else. So the 1970 was really just a somewhat arbitrary cutoff, but we thought that it was a good representation of domestic wells that may still be active, also because that's basically 50 years previous, which is a pretty long life for a domestic well anyways.
Thanks, Emily. I'm trying to get most of the questions around your presentation answered now. I'm not picking on you, but there was a question around, let's see, I'm trying to scroll through here. What was the depth cutoff that was used to define shallow?
So that varies throughout the state. There's a table in the needs assessment report that details for each groundwater basin the exact numbers that were used to define shallow, but really that varied throughout the state because there's wells at different depths in different parts of the state. So I don't have an exact statewide number for you.
Okay. And then for state smalls and domestic wells that have water quality but no well depth information, were those excluded from the analysis?
So, okay, so again, this is just a source water quality analysis, basically using proxy water quality data from nearby wells. So we didn't actually, unlike public water systems, we're not individually assessing domestic wells or state small water systems. But for water quality wells that had water quality data but no depth information, we did attempt to include that data using the depth filter with well type. So if we knew a well was from a domestic well or a state small water system, we did include that data in our analysis. But if it was from a public well with unknown depth, we looked to our depth filter to see whether or not we should include that.
Thanks, Emily. There's a question of whether or not, is there science to indicate that nearby wells are good indicators of the likely level of pollution in domestic wells? I know that that's kind of the approach that was taken.
Yeah, this is really this is like the best available data at this point in time. There is some, this is basically, our analysis was based on some data that suggests that the capture zone for a domestic well would be potentially up to 1 mile. And so that's why we used water quality data from approximately a 1 mile radius around domestic well locations as a best approximation for the water quality data there. But the best method would be to sample all domestic wells, but obviously that's not possible at this point in time. So this is the current best analysis.
Thanks, Emily. One more question, then I'll move on to some others. But this one says, I'm aware that some regional boards are collecting domestic well data. Are those represented in this analysis?
So I'm not sure exactly what this is referring to, but there definitely is a lot of data, especially from the ILRP monitoring program. That's specifically, well, that's from basically Central Valley and Region 3 wells. But yes, I believe that is included in this analysis.
Great. And I do know that there's ongoing efforts now to collect domestic well data throughout the state. And that is something that the State Water Board is trying to coordinate on so that all of the data kind of goes to one place and helps inform this effort, especially for next year's data refresh. So lots of great questions. Okay, let's see. I'm going to scroll up and let's see if we have a few questions here for Greg. Let's see, Greg, do you have a hypothesis about the relationship of the risk indicators? Are systems with water quality issues also systems with water accessibility and TMF capacity issues? Is there an inverse relationship with affordability? Based on the analysis of the data, Greg, are there any kind of conclusions we can draw from across performance on the different categories?
Yeah, good question. And I think, I mean, generally, I guess the answer would be I have plenty of hypotheses, but in terms of firm conclusions, we do need to see this data play out or be collected over several years to really draw statistically valid inferences about relationships that are causal. But in terms of correlations, I think we do see a stronger correlation between the water quality bin of indicators and accessibility, as well as relationship to being on the human right to water list. The TMF and affordability relationship to other categories, as well as to sort of being at risk of failing, is weaker with the data that we or the board has now. So those relationships are not as easy to draw out. But I think the intention, certainly, and Kristen can speak more to this, also during the affordability assessment, is to collect better data, both rate data and to collect or to calculate additional affordability metrics, as well as potentially, or ideally, to use additional EAR data on financial capacity that will allow us to test and likely see, as the question was suggesting, an inverse relationship to some extent, I would expect, between low rates and water quality. But the relationship we're seeing right now with the data that we have are more strongly nested in the water quality and accessibility space.
Thank you, Greg. There's a question of whether or not the Water Board is thinking about expanding the risk assessment to medium and larger water systems. And I can answer that one, Greg. I think that's something that we're looking at, but we want to get feedback from the public and direction from our board and upper management on that. But something that we are considering. There were questions around why did we focus on systems with 3,300 service connections or less for the risk assessment for public water systems. And if you remember my slide from the very beginning, 90% of our water systems that have violations are those systems with 500 service connections or less. It's really those small water systems. And so we were focusing the risk assessment on those smaller water systems since they have a higher probability of coming out of compliance. But analyzing all water systems is something that has come up a few times during our workshops and something that we have to think about a little bit more broadly at the Water Board. I'm not sure if Michelle or Andrew wanted to say anything about that.
No, Kristen, I think you've got it. That was what I was going to say anyhow. Thanks.
Awesome. All right. There's a question here asking us to talk a little bit more about the process for tribal water system data analysis through US EPA, since a lot of this data is not available. And what I can say here is, you know, we had to develop kind of an alternative methodology for including tribal water systems in the needs assessment this year, because you're right, there is a lack of information available publicly. We are partnering with US EPA, with Indian Health Services and others, and with our Office of Public Participation to do a lot of outreach to tribal water systems over this next year to try to see if tribal water systems and their leadership are interested in getting more involved in the needs assessment and to be part of this. What we did this year is we worked with US EPA to identify the human right to water equivalent water systems using our criteria. That's how we came up with that, that number there. For the risk assessment for tribal water systems, we did not have the same data set that we needed, that we did for public water systems. So what we did is we took the proportion, the same proportion of water systems in the state of California that were at risk. We then applied the same proportion for the number of California tribal water systems. And that's how we came up with that at-risk equivalent number for tribal systems. And really the reason why we did that is because you'll see in the next presentation, we wanted to develop some cost estimates for tribal water systems. So we needed to know the number, have a number to go off of for both human right to water list and at risk to come up with our cost estimate. So Michelle, was there anything else you wanted to say about tribal water systems and our human right to water and at-risk equivalent methodology?
The only thing I'd say is Appendix F is sort of details that methodology and what we did. So if you're interested in tribal water systems, I would recommend reading that section of the paper.
Thanks, Michelle. We do have some questions about the risk assessment data. Does it include the data that we've posted online? Does it include location? It does not include location, does have the water system name, but that's something we can add for future updates to this list. Again, that spreadsheet, and Greg mentioned it, is posted on our website, which has all the underlying raw data for the at-risk list. So if you're curious, if your water system or a water system that you are aware of is on the list, you can take a look at this, take a look at the tab that says risk assessment results summary, and the last column will tell you whether or not it's on the at-risk list or not for this analysis. I do want to again stress that this data will be refreshed in the next few months. It is using data that was mostly pulled in December, and the human right to water list that it's comparing the results to, it was also pulled in December. So what we'll do is update that, and you'll see things move around. But let us know. Go ahead.
Well, I want to say just on location, there is, I mean, the location, I believe the county is in the spreadsheet. It's also embedded in the ID number for every public water system. But I just want to be clear, additionally, that there is a publicly available shape file that you can match. And that's really what's going to be most useful if you're looking to do additional analysis, that you can match based on the ID number in the spreadsheet. So that's the best bet for really doing further analysis on location with the spreadsheet.
Thanks, Greg. No, that's a really great point. I think we can definitely add a physical address, but I think you're right in that for additional analysis, using our shape files for water system boundaries would be great. And we can provide a hyperlink to that as well. All right, going through here, trying to clean up our Q&A box. Get rid of these ones. There's a question of, does being on the human right to water list open additional funding opportunities to water systems, such as grants that would help address some of the issues causing the systems to fail? And I think if you saw in the earlier slides, being on the human right to water list puts you at a much higher priority level for funding and technical assistance. It doesn't guarantee you funding, but it definitely puts you at a higher priority list. So if you are interested in seeking financial or technical assistance, I encourage you to use those hyperlinks to submit an application, or if you email us at safer@waterboards.ca.gov, we can put you in touch with the right people to learn more. Let's see. There's a question, Greg, was potential dewatering an indicator analyzed for at risk?
It was not, and I did see that question. I wasn't sure if that was with reference to the public water system risk assessment or the domestic well and state small. I think we would welcome if the person who asked the question has a data source in mind that could be included, for coverage purposes. That was one of our main criteria for consideration of indicators was generally if the coverage was going to be feasible and certainly determine the final use of indicators. So it was not, but we'd welcome further engagement on that point.
Thanks, Greg. Yeah, we have received a number of questions throughout the process of whether or not we'll be able to include additional risk indicators that really get at drought risk and source capacity issues, especially as we move into drought. And that's something that the Water Board is working all the way up through our board members to try to figure out how we can do a better job of capturing that over this next year. I'm not sure, Michelle, if you wanted to speak a little bit more to that.
Yeah, no, thank you, Kristen. I think that is definitely something we want to expand for public water systems. Right now, the way the data is collected, it makes it difficult for us to tease that out from some of our databases. And so it's something that we are trying to work through, particularly recognizing that there's the potential for drought this year, maybe beyond drought, maybe beyond the potential, since we're already sort of in that phase. But so we will be looking at that and developing procedures internally for the public water systems, at least this year, to make sure that we can capture that.
Thanks, Michelle. We have a question here. Emily, are the state small water systems analyzed? Are they all groundwater dependent, or did were we only looking at groundwater dependent systems?
I'm not sure if that was explicitly called out in the data set we have for state small water systems, so I'm actually not sure.
Right, and that is something we're trying to get a better grasp on with our county, state small and domestic well data collection effort. So good questions coming in. Cindy asks whether or not the recordings of this webinar and the PowerPoints are going to be available and after this, and the answer is yes, of course. We post all of our webinar recordings and PowerPoint presentations on our needs assessment website, and that web link is embedded in this PowerPoint presentation. I'll make sure I share it with all of our registrants, but check out our needs assessment webpage for recordings and PowerPoint presentations. Let's see. There are a few more questions. I think we've already done this one. We have a question, there's a system that someone is interested in kind of learning more about what resources can be used to support this system. I think Marcy will be in touch. I think if you contact us through the SAFER email address, we can put you in touch with the right person. And we do have, are there any funding, is there any funding available or anything to help kind of fill these data gaps on domestic wells to help improve this analysis? What are other programs doing? They mentioned ILRP and the CV Salts program. What is the plan here? And I do know for the, as it relates to the county data collection effort, that the needs analysis unit is working on. We do not have any funding directly available to support that effort, but it is a requirement that counties submit this data to us. I'm not sure if Andrew wanted to speak a little bit more to CV salts and some of the other programs that are conducting water quality sampling for domestic wells. Maybe not. All right, well, we can circle back to that later. Okay, I am going to shut down Q&A for right now. We will come back to these questions, I think, at the end. If you have any more questions that come up, please feel free to type them in Q&A. I'm going to search and see if anyone has their hands raised, because I know we've been focusing on the Q&A piece, but I don't think I see anyone with their hands raised. Again, if you're interested in asking questions, please use Q&A. Yeah, and then I'm seeing a note coming in that we are setting up a separate meeting for Spanish speakers. So if anyone needs Spanish support, can you please email us at our safer@waterboards.ca.gov email address. I'll put that back on the screen. I want to give everyone just a 5-minute break. So please come back. Let's regroup here at, looking at the clock, let's regroup at 10:16. So 5-minute break, and then we're going to dive into the cost assessment. Okay, welcome back. And I am excited to hand things over to Tara. Henry with Corona Environmental Consulting, one of our subcontractors with UCLA, who helped develop the cost assessment model. Tara, are you with us?
I am, thank you. We can just move to the next slide. Great, so this is just a little process diagram for the cost assessment, and you'll notice there are 3 different boxes here at the top because we kind of ended up having 3 different processes for the different categories of water systems. So in the red here is the human right to water systems. So these are systems that already have a current active violation for some sort of water quality parameter. Next is the identification of at-risk public water systems. So that's what Greg had discussed earlier. And the third category is really the at-risk state small water systems and domestic wells, which use much more modeling data for water quality rather than actual having data. So that's kind of why we ended up with different processes here. We had the most data for these human right to water systems and more information about what potential solutions might be really appropriate there. So these next few slides kind of go in, they're the same steps, but in a little more detail and a little bit bigger, so you can actually see what we did here. So after the human right to water systems were identified, we really looked at the issues, and then we modeled the potential solutions using any data we could come across. There are a lot of data gaps here as well that will be improved in future iterations of the modeling process, hopefully. Next, were sort of 2 steps that happened simultaneously. We developed cost estimates for possible solutions, and simultaneously there was an evaluation of the long-term resiliency of solutions. This is important because we don't want to implement a solution that is, likely to fail due to ongoing operations and maintenance costs or the difficulty of implementation. So it's important to really evaluate, is it worth spending a little extra money to get a solution that's more sustainable in the long run? So that's what that step was about, and that's where Sac State, that was Sac State's portion of the project. So next, the best possible solution was selected for each system. And this is really just a theoretical modeling exercise for the purpose of the budget. This has nothing to do with what a system should really select as their solution. This is for budgetary purposes only. Each of these systems is going to need a firm to come in and do a detailed evaluation, hopefully with a lot more data than we had at our disposal, and really identify the correct solution for any particular system. So it's just none of the details for any of the systems in which process or which solution was selected is in the report for that reason. We don't want people to sort of misinterpret how to use this. Each of the systems will need a unique evaluation as they have in the past. Next, those costs were aggregated, and then the funding identification and kind of versus the funding gaps. So what do we need versus what do we have versus which systems will qualify? So that's what Morgan will be talking about after this section. Next slide. All right, and this is the cost assessment model process for at-risk public water systems. So the identification of at-risk public water systems, that was Greg's part that he talked about. We used that list plus the theoretical or the sort of enhanced list for the human right to water systems. So those that have kind of the E. coli violations plus a few other additional items that have been added to the human right to water list in the last month, that we put those systems actually in this group because the solutions made more sense this way. So we looked at the possible modeled solutions and developed cost estimates there, and then rolled up the cost estimates. We really focused in on physical consolidation where it was possible, and where physical consolidation was not possible, and also where physical consolidation was possible, we looked at the other infrastructure needs for systems. So things like tanks, pipelines, and this was also done for the human right to water systems. Very often when you go into these small struggling systems, they really have a lot of issues above and beyond just the water quality issues. So those will really need to be addressed in order for the system to be long-term sustainable and stay in compliance in the long run. So the cost estimate was rolled up, and then that also went into this funding gap analysis. Okay, and next, the cost assessment for the at-risk state small water systems and domestic wells was completed. And this really used a lot of that gamma data that Emily had discussed. It was the earlier pre-January version of the data that we had used. So we identified possible modeled solutions. We looked at physical consolidation. And in this case, physical consolidation was really only considered if there was another project that was identified as viable in the area. It usually does not make fiscal sense unless it's really close to some other larger system. It doesn't make sense to run, a mile-long pipeline to one well or something like that. So there's this sort of filter in this step of, is this cost effective for the solution? And if it was not really a viable option due to the distance, or there's not another potential physical consolidation in the area, then point of use, point of entry, or bottled water is considered as the solution. So the cost estimates were developed, and that was rolled up again, and then it went into the funding gap analysis piece. Next slide. So the solutions that were considered, I had already mentioned physical consolidation. For the human right to water systems, we also looked at centralized treatment, point of use, point of entry for systems that would qualify, so less than 200 connections. And then we looked at the other essential infrastructure, such as storage tanks, new wells in the case that they may only have one well and they need more, another source for redundancy, upgrading electrical panels and such, and the distribution system replacement. Then operations and maintenance for treatment systems is really key here. That can often be a failure point for small water systems where they just can't afford the ongoing operations and maintenance of systems. So they can sometimes, the physical infrastructure gets installed and then they stop running the system. So that's a real problem, and we want to make sure that we're properly capturing how much it's going to cost the community in the long run, and that can inform decisions about if it's reliable or sustainable. Then Greg's group also looked at the interim and/or emergency solutions, which can include bottled water and point of use, point of entry. So point of use, point of entry is considered for some systems a long-term solution, and for other situations it may be an interim solution while we're working to, establish a long-term solution. Another piece that was looked at but will be definitely enhanced, I think, in the future is technical assistance to these systems. So kind of providing a managerial scaffolding for them to really get to a position where they can have a more long-term sustainability. So there are other types of technical assistance in the future that would be included potentially in this analysis. Next slide. So this is just kind of a zoom in of one physical consolidation map in an area. And what you can see here is the potential receiving system border is outlined in yellow. And then we have small water systems, which are shown in blue. Very small, local small, and state small water systems are in kind of that purplish, light purple color, lavender. And then out of compliance, state small water systems are shown in these sort of bright pink color. So the triangles, that means it's a merger. It intersects with the boundary of a larger water system. And then the pipelines are slightly different colors here, but any of these lines shown are potential consolidation routes. So what we really focused on for this analysis was, can one big system connect to one small system that's, a human right to water system? So it's a one-to-one analysis. There's also a regionalization piece we looked at of like, what's the feasibility of regionalization? I'll talk a little bit about that in a second, but for the purposes of the cost model, just the one-to-one, can one human right to water system connect to one big water system? Is that cost effective? And so I'll talk more about that on the next slide. But for human right to water systems and at-risk systems, the maximum 3-mile length was used because generally after that it just gets too expensive to consider consolidation. But if you start looking at regionalization, maybe you'd want to expand that length that you're looking at. State small water systems and domestic wells, as I mentioned, were only considered for consolidation if they were along a pipeline path, just because it's too expensive generally. Next slide. So this is the map of potential consolidation. So what you can see here is the human right to water systems are in this reddish color, and the at-risk public water systems are shown as these yellowish triangles. And The systems that are colored are actually the ones that were considered for physical consolidation. The rest of these were too far away from a larger system to be considered. So this isn't the selected solution necessarily. This is just an indicator of how many systems may be close enough to a larger system to consider this. And as I mentioned, there would be potentially significant cost savings on a per connection basis if you looked at regionalization, which is connecting multiple systems along this pipeline. But we did not include that in this analysis because there are a lot of unknowns with that. You know, if any of those other water systems may or may not want to connect. And, you know, also kind of the funding challenges of funding a regional project that hasn't entirely been sorted out. Right now, you can get funding for a human right to water system, but the neighboring system, if they're in compliance, you know, that's a little more complicated at this point. So there's a lot of items that would need to be sorted out of how you would go about a regionalization project in many cases. Next slide. Okay, so this is just the potential solutions considered by system type. This is not what was selected. This is just an indicator of what we considered. So I won't go into the numbers in detail, but for the human right to water systems, you'll notice that's the only type of system that was considered for treatment. At-risk systems were not considered for treatment at this point because they're not in violation yet. So obviously, if they have a compliance issue in the future, they would need treatment in addition to this. We looked at physical consolidation for all of the categories of water systems. Point of use, point of entry was considered for human right to water system, human right to water list systems, and also the at-risk state small water systems and at-risk domestic well systems. It was not considered for at-risk once again because at this point they don't have a water quality violation. And then the other infrastructure and technical assistance was applied to all of the human right to water list systems and at-risk public water systems. And the way it was done is kind of proportional within those lists. And it was sort of applied to the aggregate list, not to an individual system, since we don't know individual systems needs at this point. That's a data gap for sure. Next slide. Okay, so as I mentioned earlier, the next step was to select the best potential modeled solution for the human right to water systems. And this is the process flow diagram for that. And the sustainability and resiliency assessment really focused in on operations and maintenance costs per connection, since that's definitely a risk factor for failure. Relative operational difficulty. So is this, you know, a treatment system that's very difficult to operate and you need a higher level treatment certification, which is hard for those small water systems to find, operator training requirements, waste stream generation. So, you know, in many ways, this somewhat favored physical consolidation, but if physical consolidation was really more than 25% more expensive than the other options, you know, it really led us to a different solution in that case. So I think that's something, you know, in the future that could have further discussion about where that cutoff should be. And of course, it depends on the specific system situation when they go in for real funding. But these thresholds were really established with the State Water Resources Control Board staff and the SAFER group in particular. Next slide. So this is actually the number of selected modeled solutions by system type. So for the human right to water systems, this was after they had gone through the process of that sustainability and resiliency assessment. So you can see treatment was selected for about 45% of the systems, whereas physical consolidation for human right to water systems was about 20% and on down the list. So there are, and it's also worth noting that there is a group of at-risk state small water systems that were considered to have no solution. So these mainly were kind of in the Monterey County region where they're too far away for physical consolidation and they're also too high nitrate concentration for point of use, point of entry. This is based on actual data that we had from Monterey County. That's why it's a little different. So as we get more real data from other state small water systems, you know, this could definitely change since these are all modeled for the most part, except for Monterey County where we had actual data. Next slide. So this is a cost range. I think we in the report, you'll notice there's kind of a point estimate, and then we also included a cost range. These are considered very high level engineering cost estimates. So that's why it's really important to consider the range. Costs will vary quite a bit on a project to project basis based on the site specific details, which we don't have. So this range sort of captures some of the unknowns in this project, and hopefully in the future, you know, these numbers will get refined. And then also this additional data that comes in will help refine the cost, but also, you know, more details around what each system has and what each system doesn't have in the future will get better. But I think it'd still be best to sort of consider it as a range, because until you get into the details of one particular system, you can't really get too detailed in a cost estimate here. And so the bottom line is, you know, the total kind of adds up to this over $2 billion to over $9 billion. So that's really significant investment that would need to be made to really bring all of these water systems up to kind of the standards that they would need to be at to be sustainable and in compliance in the future. Next slide. Okay, so another important way to look at this really also is human right to water system capital cost by system size. And what I really want to point out to you is, if you kind of look at this biggest category here, this is for number of service connections, so 3,300 service connections and greater. The human right to water system lists, you know, that would be an investment of about $4,900 per connection. Whereas when you get to systems of 100 or less, you see a huge number here. It's $86, almost $87,000 per connection. And what I think that's really points out is the economies of scale. And I think this really helps us understand why so many of the failing systems and struggling systems are these smaller systems. It's just not as cost effective. You know, if you have a system that's got 3,300 connections and have multiple wells, and only one of the wells is in violation, you can treat one well here, and it's spread across a lot more ratepayers. But if you're in this 100 connections or less, it's way more expensive because it's all of their sources need treatment, right? They only have one source. So that kind of helps us understand the issue in a quantitative way. I think, you know, a lot of us sort of have this feeling that this issue exists, but I think it's helpful to see it illustrated here, that this is why we see such a huge problem with out of compliance smaller systems, that it's just not as cost effective. So it's harder for them to, you know, get the technical, managerial, financial capacity to go get the funding that they need to really address their issues. Next slide. Okay, so this is the total long-term capital cost by county, and it's sorted by highest cost to lowest cost. And I think, you know, this is definitely confirms what a lot of folks really felt, which is there are a lot of struggling small systems in the Central Valley and Monterey area. So that's where we really see a lot of these systems that are on the human right to water list and on the at-risk list are those small systems in the Valley and in Monterey, then kind of a smattering of other counties. Next slide. So this is an important consideration, as I've mentioned before, the annual long-term operations and maintenance costs for the human right to water systems. So this would mainly apply to the treatment units that we were considering. So the treatment, here's the treatment cost there, and then for point of use, point of entry, and then the operational point estimate there is, you know, $54 million a year, and then the range here. So, you know, that's a really big commitment, and whether or not the state would want to long-term subsidize that, I think is a real discussion, because it would use up a lot of the money that could be used to bring systems into compliance. So it's really important consideration of how the long-term O&M would be paid for on all of these types of installations. Then you can see the average cost per connection is about $2,280. So, you know, that's really a lot of money if you get into DAC or SDAC type systems. So just further considerations here on how the state should be considering spending the funds that are available for these systems. Next slide. Okay, so these are the estimated interim assistance costs. So this could be something like the bottled water and or point of use, point of entry in the case where it's an interim solution. For the human right to water systems, there was a 6-year an estimate that this assistance would need to last 6 years, and for at-risk state small water systems and domestic wells, it's considered that this would be kind of a 9-year. It would last 9 years before they would have more of a long-term solution in place. So this is kind of the interim costs here that we would expect for the human right to water system list, at-risk state smalls, and at-risk domestic totals. So for a total of about $1.5 billion. And again, you know, how much of the state funding should go towards interim solutions versus long-term solutions. That's all ongoing discussion. That's really important to consider how the money should be spent. Next slide. And the tribal water system cost, I think Kristen did a good job sort of explaining how this piece was done. So less detail was available for these systems, so it did not go through the same process. It has sort of its own process that it went through. The total estimated capital costs for human right to water list equivalent and at-risk list equivalent is about $98 million. And then the estimated O&M would be about 152,000 per year, or 10 million per system for the 20 years. And the total estimate 6-year tribal emergency and interim equivalent would be about 6.7 million. And it's really important to note that these cost estimates were not included in the funding and financing gap analysis. And the main reason for that is that the tribes have access to a lot of other funding sources, plus, you know, there's a lack of detail on these particular systems. And I think further discussion will definitely be had on how these systems may or may not move forward through the SAFER program versus other options that are available to them. So at this time in this report, they were not included in the funding and financing gap analysis that you'll see in the following pieces of the presentation. Next slide.
Thank you, Tara. Appreciate it. We're going to move over into the funding and financing gap analysis piece of the presentation, and then there will be a Q&A session following Morgan's slides. So if you have questions, please type them into the Q&A as we're moving forward. A few of you have already done that. We will be addressing those questions in just a little bit. Morgan is with the Pacific Institute, another one of our fabulous partners who worked with us on the needs assessment. They were responsible for conducting the funding and financing gap analysis. Morgan, take it away.
Great, thank you, Kristen. So I just want to say too, shout out to my colleagues who I worked with from Pacific Institute, as well as others on the contract team, and some staff from the State Water Board on this analysis. So the funding gap analysis, which I'll just call gap analysis for short, was the final step of the cost assessment model process for both human right to water as well as at-risk systems. This image, as you're familiar with now, is for the human right to water systems, and as shown in orange there, it's the final step in the process. Next slide. There were two main objectives of the gap analysis. The first was to refine the estimated funding needed for modeled solutions for the human right to water and at-risk systems. And another thing I'll mention, at-risk systems in this presentation refers to public water systems, state small water systems, as well as domestic wells that were all on the at-risk list. And then, so the second objective for the gap analysis was to estimate the gap between what the refined need is, and the funding and financing available. And these results were designed to really help the State Water Board inform broader demands of the SAFER program, as well as the annual funding needs for the Safe and Affordable Drinking Water Fund itself. Next slide. The gap analysis consisted of 3 main steps, which I'll be going into more detail on these in the presentation. The first step was to refine the need or determine the estimated funding need and also to estimate the funds available. The second was to match those the refined funding need to the funds available. And then the final step was to actually calculate out the funding gap and estimate the time to meet the funding needs. Next slide. So the funding gap analysis starts here with step one, and there's sort of two parallel processes that played out. On top, we began with the cost assessment modeled solution estimates, which were just presented. So those numbers around all of the different solutions for human right to water and at-risk systems. And then we removed need from those cost estimates that have already been addressed. For example, several of the human right to water and at-risk public water systems already have funding agreements established with the State Water Board for long-term solutions. And so those modeled costs were removed from the analysis. And then we also broke out the portion of the estimated costs that we would expect to be covered by what we're calling local cost share. And I'm going to define that more concretely in a successive slide. And then the final step on this top row was to estimate the funding need over the 1 and 5 year time periods of the analysis. Then along the bottom row, you see this parallel process around identifying potential state and federal funding programs, as well as some private loan programs that could potentially help cover safer project costs, determining potential funding program eligibility, support the modeled solutions, and then again, estimating that the funding availability over that 1 and 5 year time period of the analysis. Next slide. Here is the counts of the different system numbers that went into this analysis. Has been explained a few times earlier. These counts might look slightly different than what you've seen earlier in the presentation or in the report, and that's just based off of how the analysis played out over time. The important thing here is I'm going to be talking mostly about the cumulative 5-year total, which includes projected new systems coming on the human right to water list, as well as the at-risk public water system list. We added 47 new human right to water systems for each of the analysis years, and 95 new at-risk systems for each of the analysis years. And these systems were assigned the same proportion of modeled cost needs and the same community economic status as matched the first year or existing lists. And we chose the 5-year to really look out rather than over the 10 years of the Safe and Affordable Drinking Water Fund, because we felt like beyond 5 years, there really just is too much uncertainty around things such as future potential regulatory changes, drought impacts, and things like that. And so we really wanted to be most accurate, and so we just went out to 5 years. So next slide. So these next 4 slides are specifically estimates to get the refined funding need, which is all part of the first step of the gap analysis. So this image on the left is supposed to represent a price tag, and that contains the total long-term solution costs, both capital and O&M, from the cost assessment model. So these are all the model costs. And we divided that in this first step between what costs were grant eligible and what were not grant eligible. Grant eligibilities were all based on established State Water Board policies that look at different project needs, community size, economic status. And then the non-grant eligible portion is what we call the local cost share. So this is the the modeled solution costs that we would expect local communities and private well owners to be bearing directly themselves. So next slide. And then, so looking further at that local cost share portion, we divided it between the amount that would be state water board loan eligible. So capital costs that the state water board loan programs already established would potentially be available for, as well as non-state water board loan eligible costs. And then next. And then, so on top of these, we know that any loans that are acquired are going to come with some interest payments. So we added the interest payment costs to these local cost share numbers, as well as we added in and summed the long-term operations and maintenance costs over the life of these projects, so out to 20 years for the long-term solutions. And so these all got added into the local cost share. So next slide. The final total amount of our 5-year refined estimated costs or estimated need came out to $10.25 billion. And that includes here, as is shown in the colorful figure in the middle, green at the top represents 3.25 billion that are grant eligible costs in the analysis. And then the bottom portion represents 7 billion that would be local cost share. And then these were further divided and looked at based on those 4.05 billion eligible for state water board loans and 2.95 billion not eligible for state water board loans, such some capital costs, O&M, and interest payments. So next slide. So this is sort of the second part of the first step, was looking at the funding and financing available. This is the list of the state water board funds we looked at. And basically what you can see here is for the first year of the analysis in that column, there's about $850 million. And then cumulative over 5 years, we added up about $2.7 billion of available funding. And I'll just note here that the Safe and Affordable Drinking Water Fund, as well as the Drinking Water State Revolving Fund, are the two grant programs that we expect to, that we can depend on growing over this time period. And then the DWSRF loan program, we do also expect to grow over this time period. Next. We also looked at non-state water board funds that may be both loan and grants that may be available to support safer projects. And we identified a fairly comprehensive list that is published in the appendix of this report, of the gap analysis report. And so while we didn't incorporate these non-state water board funds into the gap analysis itself, we did give in that table in the appendix a rough estimate of the dollars available in these funds, maybe that could be leveraged with state water board funds. And the boxes here on the bottom, US EPA, US USDA, DWR, US Bureau of Rec, are just a handful of the different agencies where we looked at to find different funding options, but there are more. And I will also say that in the future, it may be possible to incorporate these other funding programs into the gap analysis, but for this year, the analysis again really wanted to focus on what the state water board could fund and prioritizing state water board funding. Also, there's just a lot more uncertainty around the availability of these other funding programs and what portions actually from these other programs could be used to directly support safer projects. So at this time, unfortunately, we weren't able to incorporate it into the gap analysis, but hopefully future efforts will be able to take a more detailed look at these other options. Next slide. So that was all for the first step of the gap analysis. The second step is a lot more straightforward and just shows basically here is an overview. And that this step entailed looking at the detailed eligibility requirements of the different state water board funds and matching those to the different modeled solutions, as well as the other community status and economic status eligibilities. And so there's a table in the main report that shows which solutions were matched to which funding programs if you'd like to take a look. Next step, next slide. So the third and final step of the gap analysis was actually determining the gap and estimating the time to meet the funding needs. This is where we actually applied the matched available grant and loan funding to the refined estimated need or costs. And we took into account all potential state water board funds that could be applied to SAFER projects. We used a two-tiered prioritization based on the Safe and Affordable Drinking Water Fund expenditure plan from fiscal year 2020-2021. And those tiers are shown here. So the first tier priorities contained human right to water systems with primary drinking water violations, human right to water and at-risk systems where consolidation was the modeled solution, chosen modeled solution, and then interim and emergency solutions. And then the second tier were human right to water systems with secondary violations and at-risk systems that had non-consolidation type solutions, and then technical assistance and O&M. So, and how it basically worked to apply these tiers in the analysis was that funding would first be matched to the need in the first tier within a single analysis year. And then if there were extra money in that analysis year, after the tier 1 needs were met, it would be moved over to apply to the tier 2 needs. And so that was done for both grant and for state water board loan eligible need. And one more thing I'll just briefly mention here is that we actually did a whole separate funding gap analysis that you can find in an attachment to the main report that solely focused on the Safe and Affordable Drinking Water Fund. And so we have results for that analysis there, but today I'm just going to be focusing on results from this tiered approach. So next slide, please. So to cut to the chase, the 5-year cumulative grant funding need and funding availability, what we saw over time was that the grant funding need and the new annual grant need that came on with those new human right to water and at-risk public water systems surpasses the grant funding available. So over time, in red, you can see those bars growing, whereas the green bars are not able to meet that need. And then next slide. The larger summary here is we found for grant funding an approximate $2.05 billion gap for state water board grants and the need that would be potentially grant eligible. We found a $2.55 billion loan gap for state water board loans and state water board eligible loan need. And then another $2.95 billion of need that's not eligible for state water board loan or grant. And so those are the 5-year cumulative sort of gap numbers that we identified. As is shown in bold here, it's really important though to highlight that these gaps and this need could be met by other state and federal funding programs. And again, this analysis was really just looking at state water board funds and eligibility requirements around state water board funding, as the other state and federal programs are outside the control of the state water board. So with that, I will turn it back over to Kristen.
Great, thank you, Morgan, appreciate it. So we just concluded the cost assessment and gap analysis overview, and I'm opening it up to Q&A. We got a few questions that came in during the last 2 presentations that we'll go through. And then again, if you have a question that you want to ask verbally, you can always raise your hand, but I'm going to start with the Q&A box in Zoom. For those who are participating via the Cal EPA webcast, You can email your questions to safer@waterboards.ca.gov. We do have staff who are monitoring that inbox and can get us that question ASAP. All right, so I'm going to start at the top here in Q&A. Tara, I think some of these are for you. Is the cost range expected to go up when an MCL is added for PFAS and testing for PFAS expands? Will that be considered by the Water Board's budget request? And I think, Tara, maybe you could speak to this, and then Michelle might want to weigh in as well.
Great. Yeah, so we did not include any compounds that are sort of on the horizon to receive an MCL. So at this point, that would be the perfluorinated compounds, hexavalent chromium, cyanotoxins are currently going through sort of the notification response level development. So those have not been considered in this cost estimate. So in the future, when MCLs are developed, that will definitely increase the expected treatment cost.
Michelle, was there anything you wanted to add?
No, I mean, hopefully as we're looking ahead, the only thing that I would add would be, we are including water systems that would come onto the human right to water list each year. And that would hopefully incorporate some of those new contaminants, but again, certainly not all of them. And depending on what contaminants come with new MCLs, there may be another bump that we're seeing that we're not capturing. So it's a good question.
Thank you, Michelle. We have a question here of whether future analysis will be done to narrow the very wide range of projected capital costs for the different categories. Tara, do you want to speak a little bit to why that gap range was so large? I think that might help answer this question.
Yeah, so we considered this as kind of a plus 100% minus 50% cost range, which is the closest category for costing exercises to this type of level of detail. And I don't anticipate that you would probably be able to get a more narrow range without having a lot more site-specific information. So to me, the phase at which that would be done is when the individual system goes in and gets technical assistance or retains, an engineering firm to kind of do the site-specific analysis that would be necessary to submit for grant and or loan funding in the future. With the level of detail that's available on a statewide basis, I think it will improve, but I would, it's still going to be definitely a cost range exercise because the level of detail that you need to really get to a more tight cost band, it needs to be a site-specific analysis. And with, doing this every year with the level of detail that's available on a statewide basis, it's definitely a high-level overview cost exercise.
Thanks, Tara. And I think Michelle wants to add something.
I did. I just wanted to let you know, Tim, too, that, there are additional breakdowns in the report itself about like cost per contaminant and, cost per connection. So some of that may be what you're looking for. I wasn't sure specifically from the question that you asked. I also just wanted to make the point that what we're talking about in the cost assessment doesn't include the costs in both the cost assessment and the gap doesn't include the costs of large water system need unless they are on the human right to water system or human right to water list. So just wanted to make sure that's clear too for everybody.
Thanks, Michelle. That's an excellent point. The gap analysis and our $10.25 billion need does not reflect larger water systems in the state. All right, we have some other questions here. There's a comment from Madeline. UCLA has a pilot project in Monterey County, which provides on-site treatment for small distributed systems, which are operated remotely by experts. Perhaps this can be added as an option when the pilot project is further along. Initial results are very promising. And Madeline, I think to your point, the SAFER program, the State Water Board is really looking to learn from implementing the program and learn from others to help us refine our needs assessment methodologies. So we definitely look forward to learning from the UCLA project, in addition to all of the other projects and programs that are out there that really align with our work under the SAFER umbrella. There is a question here, I think that's a little bit broader, but I think we're ready to answer it. Could you talk about any coordination you did with Priority 1 nitrate management zones as they develop their early action plans? And could you speak to how you expect to coordinate moving forward? Seems like there's a lot of overlap and good opportunities for working together. I think, Andrew, do you want to take a stab first? And then I think there's others who are going to weigh in.
Yeah, sure thing. Hi, this is Andrew Altsvogt with the Division of Drinking Water. And yeah, we spent a good bit of time coordinating with the management zones over sort of the latter part of 2020 and into the first, through the first couple months of this year. We were mostly from our Division of Drinking Water side, we were working with them on sort of sampling protocol type issues and things around coordination of sampling of domestic wells and data, the data gathering piece of it, as well and what we could do sort of to coordinate. So when the management zones were doing their work related to nitrate, that we could also try to gather data related to other constituents of concern in the groundwater. And then we also worked with them on some issues around and some guidance around the provision of replacement water and how that's done and different options. And so there's actually a guidance document that we, the State Water Board, put out for the management zones around data gathering and replacement water. That's available on the CV Salt's website. And just so folks are aware, the early action plans are currently under review by the Central Valley Water Board. And I think there's if I understand correctly, there's a workshop that'll be happening toward the end of this month around that. And so there'll be some more information available there. I don't know if Jasmine or others have anything they would like to add.
Hi, yeah, this is Jasmine Oaxaca from the Division of Financial Assistance, and I just wanted to speak to the funding element of our coordination with the CV SALT effort. We have been having regular meetings with the coalition with regards to the long-term potential to co-fund well testing and analyses for more than just nitrate, as well as interim solution co-funding opportunities. This will require possibly entering into funding agreements with individual management zones through our SAFER program. And then I just wanted to touch on as well that in the interim, as the management zones are starting to implement their programs, we're working on appropriate outreach materials to convey that while a well test may show results that indicate that there is no nitrate contamination, it's important to understand that that doesn't necessarily mean that the water is safe, as there may be other contaminants present. So in these cases, we'll be providing information for residents to get in touch with some of our other programs that are available, for example, with self-help enterprises or Tulare County.
Thank you. Oops. Okay. Thank you, Jasmine. Sorry, my controls are all messed up right now. I hope you guys can hear me. Let's move on. We have additional Q&A. Cindy asks, for the gap analysis, how was 95 new at-risk public water systems a year developed? Excellent question, Cindy. We do explain this in the report, but we failed to do that in the presentation. So 95 new at-risk public water systems was based on the same proportion of the unique number of human right to water systems that come on to the human right to water list. So we use the same proportion for human right to water, which is based on actual observed data, and then we applied that to at-risk. We don't have any historical data on at-risk systems since this is our inaugural year, but as we move the needs assessment forward, we'll be tracking the number of systems that are coming onto the at-risk list each year, and we'll be able to refine this estimate over time. So hopefully that answers your question. Michelle, was there anything you wanted to add to that?
Yeah, no, I think that was very helpful. I also wanted to add, just Cindy, so that you know, because Aqua had several comments on our methodology, that we did make some changes to the methodology for the cost estimate, and those changes are in attachment C2, the Kern County case study, sort of where we made those in terms of distribution, replacement, and land acquisition, and some other things that you all had brought up previously. I just wanted to flag that for you.
Thanks, Michelle. We have a few more questions here. There's a comment really from Madeline. Great that you looked at federal funds for the gap analysis. Although Madeline, we looked at the federal funding and highlighted those for those who are interested, but it was not actually incorporated into the gap analysis. We only looked at available state water board funding programs. There are some larger drinking water bills and federal level proposals out there, both in the House and the Senate, that may go to, that could be potentially available to support our programs. You know, Madeline is recommending that the state support the legislation since it may help. And I know that there's definitely folks at the water board engaged in those conversations. So we will see where things go. Let's see, we've got, this is from Mike Antos. So of the costs identified in the Pacific Institute's work, so in the gap analysis, how much of these investments are capital and how much in labor? Was any evaluation of downstream positive economic impact of wages, jobs, improved reliability of water supply evaluated? It feels like a story about benefit associated with those costs and would be smart to include. It's a great point, Mike. We did not, break up our costs to specifically call out labor costs, although you could potentially try to tease that out of our estimated O&M cost numbers, but not something that we looked at as part of the scope of this effort. Is there anything that anyone else on the team, either Morgan or Michelle, would like to weigh in for this one?
Sure, this is Morgan. I'll just weigh in case Mike is interested. The gap analysis report breaks out the, like Kristen said, we don't go specifically into capital labor, but if you look at the gap analysis report, we do show the dollar amounts by these different tiered priorities. And those buckets, again, are roughly divided in that way, with solution types that are more capital focused in certain buckets, and then the O&M, long-term O&M, is in its own bucket. So again, if you look at the report, those are broken out for both the 1 and 5 year and the grant and loan need.
This is Greg from UCLA. I would also add that I think there's intention to break out the collection of project costs in a way and be able to track those things going forward, and potentially that sort of analysis could be done on broader benefits into the future.
Thanks, Greg. Let's see. Would the State Water Board be willing to further break out the needs assessment costs and funding gaps by issue type, for example, drought and water supply resiliency? Thank you, Crystal. We have received this question a few times now related to our cost assessment and gap analysis approach. And Unfortunately, we don't have enough data at the local level to really get at whether or not the solutions that need to be implemented are specifically drought or water supply related. It's something that we're interested in trying to explore this year and see what data collection we can start initiating to try to get at this a little bit more. But especially as we head into a drought year, we definitely recognize the need for this. I do want to stress again that we do partner with DWR. We incorporate their drought and resiliency results into our risk assessment, but that is just one of many indicators that we're looking at. We don't want to assume that the solutions are actually for drought and water supply at this time. I'm not sure if Michelle wants to weigh in, because I know that there's been discussions, we've been talking about this management level. Michelle, you want to talk about?
Sure. Thanks, Crystal, for the question. You know, as we discussed, I think earlier, or at another meeting, there is the other essential infrastructure cost bracket that we have some data, which may, maybe we can work with you to tease out a bit in terms of this. But I think that's something we can probably take offline and sort of do at a separate time. So perhaps we can follow up with you all on that.
Thanks, Michelle. Let's see, where is the State Water Board in terms of addressing the 300+ human right to water systems that are out of compliance? Are they receiving technical assistance or in some stage of planning for long-term solutions or working towards a safe water project? If not, where are the gaps and how does the needs assessment paper help inform addressing those gaps? Before, I think Michelle definitely will want to answer this question. Before I turn it over to her, I just want to highlight that for the gap analysis assessment, we removed the estimated costs for those human right to water systems and at-risk systems that are already receiving financial assistance from the State Water Board. So their needs were not included in the gap analysis since technically we already have funding agreements with them. But Michelle, do you want to speak more broadly about how is the Water Board assisting those 300+ human right to water systems?
Absolutely. Thank you, Kristen. So our engagement units of the SAFER program, which are two separate units outside of the needs assessment unit, we're talking about today, are working sort of system by system with DFA. We meet quarterly on all of those 300 systems to check in their progress to see, do they need technical assistance? Are they working on planning? Are they coming along? Do we need more compliance? What does each system need? And so, 90% of those systems are sort of on a path to a solution. And so they are really almost more covered by current work that's happening, whereas this is more of a forecasting for the future effort. So definitely, working on those. And I would say about 30 to 40% of those are also looking at consolidation as an option in some sort of evaluation or another. So hope that helps answer the question.
Yes, thank you, Michelle. Let's see, from Harrison, we have ideally the time and cost between water quality diagnostics and problem solution will be expeditious and cost effective. Is there an analysis of one, how many of the at-risk or human right to water sites require an emergency fix versus a long-term fix? And two, is an agency developing a portal connecting systems in need, groups with funding and engineers, operators, contractors available to complete the work? A great question, Harrison. Our cost assessment work did identify systems and tried to model costs for those that need long-term solutions and then those that may need interim or emergency solutions. And that is detailed in the paper, and we provided some summary of that. But again, that's all based off of our risk assessment results, our human right to water list, modeling for our state smalls and domestic wells, those that may have source water contamination issues. You know, really in particular for our at-risk systems, public water systems, state smalls and domestic wells. You know, those systems really need to identify whether or not emergency or interim assistance is needed if they're facing some water quality issues. And then they'll need to come to the water board where we do have assistance available. But maybe Jasmine, do you want to talk a little bit about how water systems can be connect to funding and technical assistance more broadly? Do we have Jasmine still?
Kristen, why don't I wanted to mention something while we're waiting for Jasmine. Sometimes it takes us a few minutes to find the unmute. But I did want to notice that when this question talks about emergency fixes, you know, E. coli from a line break versus long-term fixes, we really are focusing on the human right to water list. That would be more of a long-term fix. It would be more of an E. coli source issue as opposed to a short-term E. coli from a line break type issue, because that would be resolved in usually in a citation that would be relatively short-lived, as opposed to a you know, a long-term fix where we have a compliance order that's requiring something. So just to sort of highlight that a little bit while you're waiting for Jasmine.
Thanks. I think we have Jasmine. Jasmine, the question is, you know, how are we connecting water systems in need to funding, financing, the technical assistance that they need?
Thanks, Kristen. Yeah, we do have a number of programs for technical assistance available depending on, you know, where a particular system is located. We have a number of agreements already in place, and a couple, we have a new agreement we just executed recently, which expands some of our services to provide bridge loan financing, as well as you know, additional emergency repair capabilities for systems. We also have a number of regional interim solution agreements. Is that answering the question, Kristen? Sorry.
I think so, and if it didn't, I encourage folks to put more questions in the Q&A or raise your hand, and you can provide some clarification. Thanks, Jasmine. The questions that we have in the QA section, I think we'll hold off until the end. I'm going to review our results for the affordability assessment. It is the last component. You guys have been great sticking through our risk assessment and our affordability assessment results. The affordability assessment, the third component of the needs assessment, was really, it was a little bit different than the risk assessment and the cost assessment, and I'll explain kind of who we did this for. But I just want you to be aware that the affordability assessment isn't connected to the gap analysis or the cost assessment numbers or the risk assessment for that part. It is a bit of a standalone component. The purpose of the affordability assessment is really to identify disadvantaged community water systems that have customer charges that exceed something called the affordability threshold, something that's supposed to be established by the State Water Board. I think before we dig into the affordability assessment methodology and the results, I really want to stand back with all of you and talk about affordability and kind of what this affordability threshold may be. The legislation does not define what affordability threshold is, and it doesn't really give a whole lot of guidance on what type of affordability the State Water Board should be focusing on. I want to just talk to you briefly about definitions and different lenses in which we can look at affordability. And it's something that the Water Board is really trying to think holistically about. And we want to start engaging with the public, with our stakeholders a lot more over this next year to really dig into these different definitions and to think about how we measure affordability in the state of California. So in this kind of nexus, if you will, of affordability definitions, I like to start with household affordability. I think when we typically talk about affordability, that's where a lot of people start. And when we talk about household affordability, it's the ability of individual households to pay their water bills. Can they support the delivery of water to their home on a consistent basis? We then step back a little bit more, and then we can look at community affordability. And this is the ability of households within a community to pay for water services to financially support a resilient water system. You may have a community where a handful of households struggle to pay their bills. And when that is a small percentage of your total ratepayers, then it's not going to too dramatically impact the water system. But if you have a community where a good chunk of households are really struggling to pay for water, then that's really going to impact the financial resiliency of that water system. And that's what number 3 is. That's our water system. We're looking at the water system financial capacity, the affordability of the water system to be able to meet its current and future operations and infrastructure needs. We know that water systems have to pay their operators. They need to do their regular operations and maintenance, but they also have to plan for the future. Parts have to be replaced. Treatment plants need to be replaced. They don't last forever, and same with pipes in the ground. And so planning for the future means bringing in enough revenue over time so that when that big price tag investment needs to be made, they're able to do it. So the financial capacity of a water system is really impacted by community and household affordability, and vice versa. A water system, if it has to raise its rates, its customer charges, in order to pay for those infrastructure upgrades or needs in order to be more resilient, in order to provide safe drinking water, may then in turn impact household affordability when rates have to go up. So it's all interconnected. It's important to think about all of these 3 things combined when we talk about affordability, because there are trade-offs and consequences when we talk about customer charges going up, down, being high or low. So when we did our affordability assessment, there's this affordability threshold that we're supposed to be considering. And last year, for the fund expenditure plan, we looked at one affordability indicator metric, if you will, which was percent median household income. And for those of you who aren't familiar with percent median household income, what this metric is really looking at is over the course of a year, what is the average amount of a household's income that's being spent to support drinking water services, right? So you know how much you get paid in that year, how much of that money is going towards your water bill. Historically, the State Water Board has used a 1.5% threshold. If 1.5% of your income is going towards water or greater, then it's an indicator that affordability challenges may occur. Others have used 2.5% as a threshold. US EPA, other states have used that. So we actually looked at both of those thresholds in this analysis, where 1.5% was the minimum threshold and 2.5% was the maximum threshold. But for this year, we did something a little bit different. We incorporated 2 additional affordability metrics into the analysis. These metrics were also used in the risk assessment. So you are going to see them in a few places in the paper if you read through it. The first one is extreme water bill. Like median household income, we're also looking at customer charges. But in this case, we're looking at customer charges as they compare to other water systems throughout the state. If that water system's customer charges are 150% above the statewide average, or 200%, which is our maximum threshold, those were the indicators that potentially those communities could be facing affordability challenges. So that's a comparison to other water systems in the state. And then the last indicator that we used was percent shutoffs for non-payment. So if 10% or more of a water system's residential customer base experienced shutoffs due to non-payment in 2019, that was our threshold for, again, maybe an indicator of where affordability challenges may be occurring. We looked at all three of these indicators together with equal weights. We didn't weight one higher than the other. And we looked at how water systems were performing for each indicator individually. And then we also looked at how they were performing across all three indicators combined. Before I move forward with the results, I do want to highlight, because it's come up a few times around shutoffs, is we do recognize that there is a shutoff moratorium that has existed for most of 2020. And so we do not plan on using percent shutoffs as an affordability indicator for our next needs assessment. We are using the 2019 data that was submitted through our electronic annual report, which closed in the summer of last year for this data set. So just wanted to make sure that that was clear. I also want to emphasize that, we did identify during our methodology development process over this last year, many other potential affordability indicators that we could be using in this assessment. We were very limited in data availability in this year's assessment, and we are trying hard to work with our partners and our water systems to collect new data to help make more robust affordability indicators. There has been some criticism of percent median household income as an indicator for affordability, and so we definitely want to be looking at a broader set moving forward. So stay tuned. I'll talk a little bit more about that later, but just wanted to highlight that we are planning on refining our affordability indicators moving forward. But we were excited to be able to add a few more this year compared to what we had last year. So who was included in the affordability assessment? You guys heard about the risk assessment, which was only 3,300 service connections or less for public water systems. Our cost assessment and gap analysis looked at both our human right to water list and our at-risk public water systems, state, smalls, and domestic wells. Our affordability assessment is different. Our affordability assessment looked at all community water systems statewide, focusing on DAC and SDAC water systems. We did, however, if you look at the report in the results section, we did also call out which human right to water systems and at-risk public water systems were meeting these affordability thresholds. But based on how SB 200 reads, we needed to really focus on our DAC and SDAC systems. The water systems that are not included, and I really want to emphasize this, the state small water systems and domestic wells were not included in the affordability assessment. We don't have enough data to really conduct a robust affordability assessment yet for state smalls and domestic wells, although this is something that we definitely would be interested in exploring in the future. So if folks have ideas, please don't hesitate to contact us. But you can see here in the table the difference in the number of systems included in the affordability assessment. Not all human right to water list systems were included, but all the ones that met the community water system status were definitely included here. So these were the results, and I'm only going to be sharing with you the DAC and SDAC system results. If you look at the results paper, you'll see that we also break it down by human right to water and at-risk public water system status as well. Here we're looking at the performance for each individual affordability indicator. You'll see that percent MHI, median household income, had the most water systems that were exceeding the minimum threshold. Again, if you look at the paper, you can actually see the ones that exceeded the maximum threshold as well, but we wanted to focus on the minimum thresholds. 121 DAC systems, and then 313 SDAC, and then a handful of non-DAC systems exceeded percent MHI. Extreme water bill, those numbers went down a bit, 113 DAC, 122 SDAC, And then percent shutoffs due to non-payment, even smaller, so 35 DAC and 62 SDAC systems. So that's looking at things individually. But we wanted to, again, do a bit of a cumulative analysis, and I just realized that graph is missing. But what we did do in the paper, if you pull it up, is we looked at the number of systems that exceeded more than one threshold. So if you had a water system that exceeded both the percent MHI and the extreme water bill, we have that number of systems that exceeded 2 affordability thresholds. And there were a handful of systems that actually exceeded all 3 affordability thresholds. So those are all listed in our paper. But we also have a spreadsheet that is available to download online that does list the water systems, what their metrics were for each indicator, and how they scored. So if you take a look at that spreadsheet, there is a summary tab, the assessment score. You can play with that and take a look at which systems exceeded 1 indicator or all 3 indicator thresholds. You can look at their DAC status, SDAC status, and whether or not they were on the human right to water list or the at-risk list. I do want to emphasize here that we did use a very, very similar approach to what DFA uses to try to determine a community's economic status, whether or not they qualify as DAC or SDAC. There's only a slight modification to the approach used by DFA. You can look at our methodology write-up in the paper to learn more. But there were still a lot of systems that we were missing data for. And you can see that in the spreadsheet, kind of where we're missing data. We are trying very hard to fill the gaps. And we look forward to working with all of you to fill the gaps in our data. Again, we anticipate that some of you might look at this spreadsheet and maybe the water rate data that was collected through our electronic A&M report, maybe that was inaccurate. There's a form that we've created for data change requests. You can fill this in, submit it to us, and folks with our needs analysis unit will review those requests and work internally to see if we can make those data change requests happen. But that's it for the affordability assessment. I'm going to briefly run through some high-level conclusions and next steps, and then open it up to a broader Q&A where we'll talk about the affordability assessment and any other lingering questions that you guys may have. What I think is really important to remember about our needs assessment is really 2 things. It is an annual assessment. We will be conducting this every year for the SAFER program, as long as the SAFER program exists. But it's iterative. So we definitely plan on refining and improving our methodologies as we move forward. You know, as our program grows and is implemented, there's a lot that we're going to learn from water systems, from the public, from each other, that we're going to want to incorporate into our needs assessment. The methodologies that we've outlined for you today really are our baseline methodologies. This is what we were able to develop with our best available data, with the brightest minds in California. But, you know, this is, we really look forward to working with all of you as we implement the program to talk about how to refine these approaches. So definitely stay engaged with us. We're going to be hosting more workshops and webinars, maybe not as much as we did in our first year, but definitely there will be opportunities to weigh in on our refinement process. If you take a look at the report, we do break down for every component of the needs assessment opportunities for refinement, and we recognize some of the limitations that exist in our current methodologies. Some of the big picture kind of refinement opportunities that I wanted to highlight that we're going to be really focusing on over the next few years are listed here. Improved data is definitely one of them. For anyone who's been involved in our methodology to process thus far recognizes that data limitations definitely you know, restricted some of the types of analysis that we could do. We have identified, especially through the risk assessment and affordability assessment development process, a whole list of potential data points that could really help improve our methodologies. We're working internally within the State Water Board to develop additional questions for the electronic annual report, trying to be really cognizant of reporting burdens and be really strategic about the types of questions, new questions we include in our electronic annual report for water systems. If anyone's been following along, we have started collecting new financial data this year for the 2020 electronic annual report, which we're hoping to incorporate into our assessments moving forward. Another big one is alignment across the needs assessment components. I mentioned this before we dug in. One of the challenges this year, in that it was our first year, was that a lot of the different components of the needs assessment were started at different times, which led to different data sets being used. So we really definitely want to make sure that we're starting everything at the same time next year. We have everything kind of planned out, which will be great. And furthermore, I think, we want to be able to better incorporate the results of the risk assessment, for example, into the cost assessment. So there are definitely some alignment opportunities that we highlight in the paper. I encourage you to read. Focus scope is a big piece of this, especially I spoke earlier about the affordability assessment. If we're going to refine that further, should we be focusing equally across all the different kind of lenses of affordability, or should we focus in one particular area? So, your input on focus scope is definitely important. Again, we've highlighted in a few areas. Expanded outreach for tribal water systems is really important to us. We did develop some alternative methodologies to incorporate tribal systems into the needs assessment this year, but we know that we could do better. So we want to definitely work with our tribal partners to identify a way to improve our incorporation of tribal systems in the needs assessment. Alignment with other state efforts is critically important. We've already begun working with OWIHA, DWR, CPUC on a whole host of topics that are interrelated between our needs assessment work and works that their programs are undertaking. There definitely can be more alignment, and trying to get in touch with everybody is definitely a high priority for our program. I've already spoken about the refinement of the affordability assessments. I'm going to skip over that one. And you've heard me mention this a few times as well, but learning by doing. We definitely are at the beginning stages of implementing the SAFER program. There's a lot that we're going to learn as we work with more and more systems, and we engage with our at-risk systems and our human right to water list systems. And we want to take that learning and help refine our assessment. And then continue public engagement. We want to continue to work with the public, obviously, to continue incorporating your ideas, your recommendations into our methodologies. This is just a brief snapshot of our SAFER timeline coming up for the rest of the year. I want to highlight that that does not include any of our needs assessment refinement workshops. We're still trying to get those scheduled, but there's a lot of work being done with our SAFER advisory group that helps inform the prioritization of the fund expenditure plan. We have some workshops to tribal systems that are scheduled, and a few more. So I encourage you to take a look at our SAFER programs calendar on our website, where all of this will be kept up to date if you're looking to get more involved in the SAFER program. And last but not least, I really want to encourage everyone to reach out to us after today if you have lingering questions that we can address during this Q&A section coming up. If you have a data change request, again, we ask you all to use that web form that we've provided the hyperlink to in a few places, including here. But we're always open to broader feedback. Please email us at any time, the saferwaterboards.ca.gov. If you have any specific feedback on the report itself, it would be great if you could provide it by July 1st. And I mentioned earlier, we do have a web form that has the survey, the poll questions from this webinar and the discussion questions. If you are interested in providing feedback in that format as well, you can. And before we get into Q&A, I have one last poll question. As I mentioned previously, we do have 2 spreadsheets that are available on our website for the risk assessment and the affordability assessment. They do have a lot of data. Wanted to know if anyone is interested in us hosting like a informal brown bag session with the public, with water systems, to help you figure out how to navigate those spreadsheets. Some of you may not have had an opportunity to look at those yet, which is fine. And you can just indicate that here. Give you guys a few more seconds to fill out this poll. All right, end it in just a few seconds. Okay. It looks like the majority of you are interested in these additional sessions, which we can definitely set up. So we will definitely reach out to you. If you're hopefully subscribed to our SAFER mailing list, you will get a notification through there, but we'll also try to reach out to the registrant list for this webinar so that you don't miss out. Okay, and with that, I'm going to shuffle back over to our question and answer box. I'm going to start at the top. We had someone previously who submitted a risk assessment related question, but we weren't able to get to it yet. The question is, what is the plan to scale up domestic well and state small water quality testing within high risk aquifer areas? I know that Andrew spoke a little bit about some other statewide efforts on this. I'm not sure if Andrew is still with us and wanted to just highlight his answer one more time.
Sure, this is Andrew Altspoke, the Division of Drinking Water. And so, in answer to a prior question, I mentioned some of the work that's going on in the Central Valley, specifically in priority areas for CV salts, and so that's just one of a number of efforts where there will be more attention paid to domestic wells, domestic well sampling. There's also been some efforts in the Central Coast, and so I think we will see more and more of that. I think that'll also be part of a discussion that'll happen around once we get into the public workshops and the board hearings around our fund expenditure plan, in terms of how we can best address domestic wells. Thanks.
Thanks, Andrew. And I think Jasmine had an additional comment.
Yeah, thanks, Kristen. I just wanted to add that we do have a number of funding agreements currently where well testing is being conducted. And so as part of those agreements, we've been requiring our recipients to enter that data into GeoTracker. So hopefully, or is it Gamma? I apologize, but into the database. And so hopefully that will help, further expand the data set that we have currently.
Great. Thank you, Jasmine. We have more of a comment than a question from Mike. The other side of affordability, which is perhaps outside the scope of State Water Board, is the amount of income people receive from their work. If fewer Californians were near poverty despite being fully employed, more Californians would have money to collectively invest in public works. So thank you, Mike, for your comment. We have a question around, please explain what action is taken when a household meets the minimum threshold. Thank you. I'm assuming that this comment is around the affordability thresholds. I'll respond, and then Jasmine, might be worth you hopping on too. For the affordability assessment, it's really meant to the results are meant to inform the Division of Financial Assistance and others that are working on this topic. DFA definitely has procedures and policies in place for how a community's economic status determines or weighs in on how much grant or loan eligibility they may receive. but there is no official kind of action that the State Water Board takes for all the systems that we said were exceeding a minimum threshold. But Jasmine, did you want to talk a little bit about how DFA utilizes kind of these affordability indicators?
Sure. Kristen is right. So I think historically we've been using that kind of 1.5 or 2.5% of the median household income to determine grant versus loan. But we are, as part of our work towards finding out more about direct operation and maintenance assistance and what that looks like, we will be conducting a pilot study to look at various systems and how direct O&M support can affect those systems' ability to take on their O&M. Additionally, there are going to be further discussions on the affordability threshold with our Safer Advisory Group in the later part of this year. And so I think there's work yet to be done in determining how we can use that affordability threshold in something like a low income rate assistance program. I know that's work being done in one of our other offices within the water board, but we'll have to figure out how that all comes together with the SAFER program moving forward.
Thank you, Jasmine. Tara, I think this question's for you. It's a clarification of the cost assessment numbers for the selected model solutions by system type. The question is, how does the cost assessment model consider the trade-off between higher capital costs for consolidation versus the much higher O&M costs of treatment? Is the best solution really installing treatment systems on 80% of the human right to water systems, and would the O&M be paid for exclusively by the human right to water system and not the state, as indicated in the presentation? So maybe Tara, speak a little bit to the selection of the solution. I think it's probably good to highlight again, that we looked at the long-term sustainability and resiliency of these solutions, which looked at O&M costs per connection.
Yeah, I think if Maureen's still on, she maybe actually should answer this one. I think it is important to consider that, and it really in the end would be a system by system decision. So just because we've identified one theoretical solution for budgetary purposes does not mean that that's what the actual solution selected will be. So I think that's an important piece to understand. And I definitely think there's room for discussion about what the appropriate trade-off is there. How much extra would you maybe be willing to spend on physical consolidation to avoid that treatment option? So, but I'll kick it over to Maureen since her group is way more in the weeds on that piece.
Yeah, thanks, Tara. Yeah, so for Tara, during her presentation, mentioned the sustainable and resiliency assessment, and that was essentially looking at several different factors that considered impacts other than just costs. And so, to the point of some of the questions you had as far as operation and maintenance costs and waste management and things like that, some of those were included. Some of those types of factors were included in that sustainability resiliency assessment. And then we kind of developed a scoring method similar to what was done for the risk assessment. But this case, it's comparing multiple different solutions that would be possible for a particular system. However, we were just comparing solutions. We weren't necessarily looking for site-specific decisions or looking to get site-specific data, especially that which wasn't available or more difficult to get or process. So we did include to some degree some of those factors that you were asking about, and you can read more about it, and there's a special appendix regarding the sustainability and resiliency assessment as far as the different factors and the process we went through to select them, and how that came about and how the ultimate final solution was selected.
Thanks, Maureen and Tara. We have a question here, which I think perhaps Jasmine or even Michelle or Andrew may want to weigh in on, but how will the needs assessment help inform the fund expenditure plan and the drinking water IUP? Will the needs assessment figures identified allow for the $60,000 per connection cost identified in the IUP up to be reevaluated?
Hi, this is Jasmine. Yeah, sorry. So the needs assessment will directly inform the fund expenditure plan that's required by statute. As far as the intended use plan, I know that the intended use plan for this current or this upcoming fiscal year is already being drafted, and I think a public workshop is coming up very soon. So I would imagine it would be a little bit too soon for the needs assessment to really influence this upcoming intended use plan, but perhaps it would be a consideration in the future. I know that our SAFER program in general, through what's funded by the Safe and Affordable Drinking Water Fund, for example, when we're looking at planning and construction projects, we are also deferring to the Drinking Water SRF intended use plan. So I do think that there's potential for the intended use plan to be influenced by the needs assessment moving forward.
Thank you, Jasmine. We do have a question from Hasna, and I apologize if I'm pronouncing your name incorrectly. The question is, will there be more emphasis given to emergency response to water services due to power outages, for example, during PSPS? A long system solution can be designed for managing risks from this type of emergency.
Thanks, Kirsten. This is Jasmine again. I can weigh in on this. So we do have funding available that we already use for general emergency response. This is typically related to emergency system repairs, so at the system level, either through our general fund or allocations or the Safe and Affordable Drinking Water Fund. And we are currently in the process of developing a new funding program for emergency generators focused on water systems in disadvantaged communities as a start. And so that program is expected to be coming online this summer. So I guess more on that to come as far as eligibility and other requirements.
Thank you, Jasmine. We do have a hand raised by Michael Prado, if I'm pronouncing your name correctly. Michael, I'm going to allow you to talk if you would like to ask your question out loud. You will need to unmute yourself, though.
Can you hear me now?
Yes, we can.
Hold on, I got something wrong here. I can't hear. Look at my speaker on.
Oh, we can hear you, Michael. Can you hear me? All right, maybe we'll come back to Michael, or Michael, you can use our chat.
It's all right, just go ahead.
Okay.
Just continue, I'm sorry.
Okay, we'll go back to our chat box and hopefully Michael will be able to figure out his speaker issue. We have a question here. Do you anticipate doing an analysis of regionalization options in a future needs assessment? Is that work already underway? Thank you, William, for your question. There actually was a regionalization analysis done as part of our work, but it wasn't incorporated into the cost assessment. And maybe, Michelle, you'd like to speak a little bit more to this?
Sure. In the report itself, it shows sort of the top 10 areas where regionalization would be most cost effective in California. And then additionally, and we're working with Corona Environmental, who also shared with us some of the other GIS databases and different maps and layers that we can use now to continue that work. And as time moves forward and we're able to work through those, we will see what we can make public as well. You know, we just have to sort of go through and do some data categorization and things like that first. But it is our hope that that would be coming in the future. I also wanted to just, while I have the floor for a second on regionalization, I did want to put a plug in. We are going to be putting out a map of where we've done consolidations in the past since 2016. So historical consolidation work. So please look for that in the next few weeks to be coming out. Thanks.
What's up, guys? Did you
Thank you, Michelle.
How do I put my speakerphone on?
Hi, Michael. We can hear you now. Can you hear me? Okay. Gonna mute him. All right, we have another question, a follow-up question on domestic well testing. Are the agreements to gather more domestic well data solely for management zones, or are the agreements in place with other entities? I think, Jasmine, you can answer this.
Yeah, so I just wanted to clarify that what I had meant earlier is that we have some existing agreements in place with nonprofit entities like self-help enterprises, where they, as part of their program with us, they're conducting well testing and then, for example, installing a point of use treatment device as well for households. So as part of that agreement and other similar agreements we have, we're requiring our recipients to upload that data into the appropriate database.
Thanks, Jasmine. We have another question. What efforts are being made to involve the regulated community who contribute to the sources of pollution, for example, irrigated ag, dairies, etc., to augment the funding available to assist state small water systems and domestic wells? Michelle or Andrew, is that one that you'd like to tackle?
Hey, this is Andrew Altsvogts. I'll take a first shot at that, and then others can add in. So, I mean, I think there are a couple things. The main place that this is happening is through the CV salts efforts, where in that case the regulated community is responsible for working through the Central Valley Water Board and and providing replacement water, as it's sort of defined in the CV salts basin plan amendments, to areas where there's nitrate pollution, and so irrigated ag and dairies and other responsible parties are part of that whole effort. There have been some other efforts, like the one I mentioned previously in the Central Coast region, where they've gotten some money from settlements, monetary settlements related to different types of violations of their water quality standards, and those monies have gone in to do work related to the state smalls and domestic wells. And so, those are, in terms of the involvement of the regulated community, that's really a matter of coordination between us and also and the regional boards who deal more directly with those folks in the regulated community. And the other thing I should mention is, there are efforts related to 123 TCP. Now, most of those have been have been through, individual communities or cities who have reached settlements, and then the money from those court settlements have gone to addressing some of the issues related to 123 TCP. So there are a number of different things going on in that regard. Thank you.
Thanks, Andrew. I want to be cognizant of everyone's time. We are at noon. We have one last comment that came in, and Emily, this is for you. We have someone who's interested in a brown bag training on how to navigate the aquifer risk map. Is that something that you think you might be able to host?
Yeah, we'll definitely look into that for sure.
Awesome, that's great to hear. Alrighty, let's see. We have one last question. If anyone wants to stick with us, have you considered incorporating targeted groundwater recharge as a solution for improving systems and wells by increasing groundwater levels and diluting certain co-contaminants? And I'm not sure. I think that groundwater recharge is definitely something that's happening in a few places throughout the state. And I think, not sure if anyone else wants to weigh in on this, but I know that it is a local decision, and I know groundwater sustainability agencies are definitely playing a role in some of those discussions. Did anyone want to weigh in on that?
Sure, this is Andrew Altavogt again. I'll weigh in very briefly just to say that we are also looking at coordination opportunities between the Sustainable Groundwater Management Act and those activities that are being led by the Department of Water Resources, and the SAFER program and our drinking water program in large. So that's really where those discussions are happening. But I would say mostly they're happening through the groundwater management plans that are being submitted to the Department of Water Resources.
Thanks, Andrew. And with that, just briefly wrap up. Again, it's been noted a few times, but this PowerPoint presentation and the webinar recording will be posted on our needs assessment website, on the State Water Board's webpage. In probably a few weeks, we might be able to get the PowerPoint posted sooner, but we need to make it accessible. So stay tuned. As soon as it's available, we'll definitely share it out to everyone who is registered for today's event. I do want to extend a huge thank you to all of all of our panelists today and the teams, all of the people who at UCLA, Corona Environmental, Pacific Institute, Sacramento State Office of Water Program, and the UNC Environmental Finance Center that wasn't able to join us today on this webinar. We had such an amazing team part of this effort in developing our methodologies. It's been fantastic working with them. I encourage you all to take a look at the final results report that is posted on our needs assessment website. We have it broken out if you need it. And please be in touch if you have any questions or want to follow up with maybe a data change request. Again, thank you again. We appreciate you sticking with us this morning. I know it was a lot of content. Take care.
Thanks, everyone.
Thank you, everyone.